Hi,
Hi.
my name's Brianna. I'm a level 1 nursing student, and I was wondering if it's okay if I could shadow you today.
Sure. My name is Melody. I'm going to be the nurse for Glenn Light, who's our patient in room 619. He's 67 years old. He's 5'11", 171 pounds, no known allergies, full code. He is a fall risk. He's here because he has type 1 diabetes with a 20-year history. He's a 3-week-old stage 2 diabetic ulcer on his right heel. He's also on a diet restriction of 1,800 calorie with a 2 gram sodium diet. His blood glucose readings have been in the 300s for the past 5 days, which he's usually in the 120 range. He does have a history of transurethral prostate resection that he had 5 years ago. He's alert and oriented ×3. He denies any headache, any dizziness, any vision changes or confusion. He does admit to tingling in bilateral extremities that has gotten worse in the past 3 months. Besides that, he does have a 5 out of 5 muscle strength in all of his extremities. He's on room air, denies any cough, chest tightness, or dyspnea. He has normal S1 and S2 sounds, no murmurs, no gallop, rub, or anything like that. He denies any chest pain or edema. His bowel sounds are normal, active in all 4 quadrants. Last bowel movement was yesterday. He denies any nausea, vomiting, constipation, or diarrhea. He's been voiding normal, denies any problems with that, no polyuria. His urine output was last at 1550 and it was 320 milliliters. The doctor does want us to consult a wound care nurse for care for his heel, his ulcer on his heel. So we're gonna have to do that while we're in there. His last vitals were taken. They were all normal. Blood pressure 128/70, O2 was 96, pulse 76, and respiration 16. And they've all been normal within the past hour. So he is on a couple medications, but we're going to be giving the insulin today. His sugar was 290, his last check, AccuCheck. He's on insulins, gabapentin for his neuropathy, and lisinopril and hydrochlorothiazide. His last meal was 5 hours ago, so his sugar is a little high. The doctor also wants us to order a CBC and a CMP. His red blood cells are a little low. Normal would be 4.7 to 6.1. He's at 4.5 right now. His fasting glucose was 310, which is way too high for his type 1 diabetes. So we're going to go ahead and give him this medication.
Why specifically is the client receiving this medication?
He's receiving the insulin because his sugar is too high and he's a type 1 diabetic.
What action does the medication have on the body?
The action that this medication has is it's going to lower his blood glucose levels by providing the body the insulin that it's not producing with his type 1 diabetes.
Okay. When should you question administering this medication?
We should question when, if we do an AccuCheck and his blood sugar is like below 70, that would be too low to give the insulin. The therapeutic range of blood glucose is between 70 and 120.
Does the medication have a therapeutic serum level?
It doesn't, but we just need to watch those AccuChecks for his blood sugar level.
Okay. Which vital signs should we monitor?
We want to monitor the regular vital signs, but we want to specifically look at that blood pressure, his respiration rates, and the O2 stats. We want to make sure that he's not going into any hypoglycemic episodes or anything like that after the insulin dosage is given.
What physiological parameters should be monitored when the medication is being administered?
We're going to monitor the patient's mental status, make sure they're not confused, lethargic, having any type of weakness. That would all point towards hypoglycemia.
What interventions must be taught to the client to ensure the medication is being administered safely in the hospital?
Sure. We want to make sure that the patient knows to rotate the sites weekly of giving the insulin. We want to make sure they know how to administer their insulin correctly, how to draw it up correctly, make sure there's no air bubbles in it, and how to read the sliding scale on the syringe.
And how about at home?
At home, we need to make sure that they know those things as well as when they should be giving their insulin, and what signs would point towards hypoglycemia to watch for.
What are the side effects and potential adverse reactions?
The side effects, I think the main one would be hypoglycemia. You want to, like I said, make sure that you're not giving it to them when their blood sugar is already too low to be giving them that. And that would be the main thing that we want to watch for in this patient.
And how will you know when the medication is effective?
We will know by his blood sugar dropping. He's at 290 right now, so we want to try and get it between 70 and 120. For him, he's a type 1 diabetic, so we want to make sure that it stays in that range
Okay.
to promote his healing with that ulcer. All right. Any more questions?
No, I think we're good.
Okay. Hello, Mr. Light. My name's Melody. I'm going to be your nurse. I have a nursing student with me. Her name is Bree.
Hello, Bree.
Hi.
Just going to wash my hands. And what's your name and date of birth?
Glenn, and I'm 67 years old.
Okay. And do you have any allergies? Okay. So I'm just going to scan the armband. Make sure it matches my patient. Oops. You know what? Silly. Let's try that one more time. Okay. So it did pull up our patient. Glenn Light. So I'm just going to wash my hands. And Mr. Light, we're going to be giving you insulin called Lispro. Because your sugar is at 290 when we last took it, which is too high for you. We want to try and keep it around 70 to 120, okay?
Okay.
Alright. We already checked. He confirmed that he doesn't have any allergies, which also matches with his medication record on here. This insulin we give you 4 times a day, and the dosage is dependent on what your glucose reading is. And since it was at 290, the doctor has ordered 6 units to be administered to you. Okay, I'm just gonna pull out the medication here. We've got 2 alcohol swabs, one for the patient, one for the vial. We match it. Check the expiration date; it's not expired. It is the correct medication. I'm sorry. I have to scan your arm bracelet one more time. Sorry. There we go. There we go. So you're just going to verify it did turn green. This is the right medication. He does get it 4 times daily. It's due right now at 1700. It's going to be given subcutaneously. The doctor ordered 6 units based on things. So we're just going to wipe this off. Take off this little cap. Leave that there. And we're going to pull back to 6 units. And that's the air that we're going to inject into the vial. Back. 6 units. When's the last time you ate, Mr. Light?
Oh, about 5 hours ago.
Okay, so we're gonna order a dinner tray for you. Okay, and what area did you last use to give your
Up here.
Okay, so what area do you prefer this time?
Down here.
Okay, so we're gonna give it in the lower left-hand quadrant. We're just gonna sanitize the area. And you do understand you have the right to refuse this medication if you don't want it. Are you okay with us giving you?
I'm absolutely okay with it.
Okay. All right, so we're just gonna pinch the fat, and we're gonna go ahead and give it at a 45-degree angle. Wow. We're gonna put this in the sharp spin. feel okay?
Yep, I feel fine.
All right. Not feeling any lightheaded or dizziness? Okay, good. And I do see that you are on the 1,800 calorie diet, so we need to go ahead and give you some education on that. It's you're also on a 2-gram sodium restriction diet, okay?
Okay.
So here's some medications or some paperwork on that. Do you have any questions about your medication?
Nope, I'm okay, thank you.
And you know when you're at home, you're going to be rotating those sites, okay? And I know your wife knows how to give the insulin at home, so that's good. Do you have any other questions?
I'm good, thank you.
Okay, and you know to ring your call bell if you need me.
Yes, thank you.
Okay, so we're just going to go ahead and chart that we administered it at this certain time. Just wash my hand. And that we did give it in the lower left-hand quadrant of the abdomen. Okay. All right, you're all set.
Thank you.
Okay, take
Guys,
care.
later.
Yes. Have any other questions?
Yes, I do actually. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, you want to check that blood glucose, you want to check the allergies, make sure that they don't have any to that medication, make sure it's the right medication that you're giving the patient that's ordered by the physician.
Okay, did this information affect your decision to administer the medication?
Yes, well, it didn't because he was in the normal range, or he was in the range to give it. He was too high at 290, so that did affect it by me giving it. If he was too low, then I wouldn't have given it.
Okay, did this information affect how you administer the medication?
No, because he was too high, so I gave him medication.
Okay, well that's all the questions I have.
All right, thank you, Ree.